my GYN during a routine breast exam. She said something feels different. And so she sent me to have a diagnostic. They said, we want to also run an ultrasound. They did a biopsy and said, we'll let you know. And I got the phone call from my doctor to tell me that, yes, it was positive and you have breast cancer and now we need to do this and this and this. Even though I was shocked and it was a little scary, I was kind of like, okay, game on. I did have surgery. I had a lumpectomy. So I had the surgery, recovered pretty well. Then again, decided to have the chemo and the radiation as a follow-up to that. My radiation was finished 2 days before Thanksgiving. So that was a big celebration. My life took a major leap when I met my husband, my second husband. I was very happily remarried to Gene. And again, kind of rocking along in my career, after one particular weekend, I told Gene, I said, I do not feel well. I actually think I need to go to the ER. And it turned out that my lungs were full of blood clots. When they did the scan on my lungs, a technician made a little note that they saw a little shadow down in the lower quadrant that had everything sent to my oncologist. And she said, I'm sure it's nothing. And she said, but I'm going to do a scan on your pancreas. And she says, we're going to send you to a gastroenterologist. So I had the endoscopic ultrasound, and when I came to, that is the first time I've ever heard neuroendocrine. And I remember going, what? Guess what? It's a rare cancer, and we don't know very much about it. And so they referred me to a surgeon. He took out half my pancreas because he saw some lymph node involvement, took out my spleen for good measure because it's right there. And I was told, okay, so you're good to go. Go live your life. And it wasn't until 6 months later that I really had a better understanding of what I was dealing with. Until that night, Dr. Sajay Gupta comes on CNN and draws his little chart and starts explaining that Steve Jobs had neuroendocrine cancer. And I was devastated. I mean, I look at Gene, and Gene had tears in his eyes. And he goes, I want more than 8 years. And I was like, so do I. And I Googled neuroendocrine, and this time a face popped up in the very top search, Dr. Eric Liu at Vanderbilt, the Neuroendocrine Center. And I went, what? There's a neuroendocrine center in Nashville? And then he said, so I'm going to order an MRI. Less than 30 days later, I had the gallium-68 scan. The MRI was completely clear. The gallium-68 lit up 2 tumors. One of them had grown a little bit more than he liked, and it was also near my heart. And he said, I think that one needs to come out. I trusted him, and I said, let's do it. Then the plan was, okay, we're going to continue to watch this one that's left to see if any more pop up. And they did. I am back to the watch and wait. More than likely, I may have to have more tumors resected. When I first met Dr. Liu as a patient, I asked him, how come people don't know about you? Why is there more education out there about this? And he said, I know. It's a problem. And I said, well, we need to do something about it. So the idea for the Healing Net Foundation, I think, came together because I know what it felt like when I found a doctor who understood my disease and understood all the options that were out there. And so as we started talking about this, we realized that the niche that really needed to be filled was to help educate other doctors out there. So we created the Net Primer for healthcare professionals. It was important for that to be written in a peer-to-peer language. And so thanks to funding, we were able to offer this free of charge. So the first thing we did is we sent it out to all the support groups we could possibly send them to. And people started walking into their doctors. And now we've expanded our SAC, and they're helping us reach out to specialists. And also NANETS, who I mentioned as the Doctor Society, they did some regional conferences this spring, and they handed out our brochure. A huge dream came true this year. Dr. Liu had this idea. Let's bring the doctors from Europe over. Let's get them together with the ones from the United States. Let's create this summit. And next thing you know, we were putting this thing together. And we pulled it off, and they all showed up in Beaver Creek, Colorado. 30 faculty. There was 6 or 7 from Europe. They came together, they were in one room together, and there's conversations afterwards where they're collaborating with one another. We're going to do another one. Neuroendocrine is a very complicated disease, a very complicated cancer that does not fit in a box like other cancers that have normal protocols. So the mission of the Healing Net Foundation is to get resource material, to get education in the hands of the primary physicians so that they have the toolbox that will help them give the patient the best possible care. And then, in addition to that, we have a patient path, and we want to be able to connect those patients to the doctors who really do know about neuroendocrine and understand what they need. As sailors, we brought back an idea to our local sailing club of doing what's called a hospice regatta. There's a National Regatta Alliance that kind of pulls all this together. And they have a saying that says, "We cannot direct the wind, we can only adjust the sails." So I think the same analogy applies to fighting cancer. I can't do anything about it. I have it, but I can adjust my sails and I can ride out the storm. I'm Cindy Lovelace. I'm a wife, I'm a Mimi, I'm a mom, I am a friend, and I am a hopeful encourager. I am a cancer survivor.